I'm Zoe Shuttleworth and I work for It Happens Education, and in this session I'm going to be talking about why it's so important that we take a harm reduction approach to education.
Why do you think that drugs education is so important?
So I worked in drug and alcohol treatment for 15 years. And actually what I realised was that the people that I was working with had never had any sort of substance education, either at schools or really from any health professionals. They had learnt everything they knew from using with other people. And actually, they were usually only getting information about how to use more safely when they actually came into a treatment service, which was usually quite a long time after they'd first started using. And in quite a lot of cases, some damage had already been done that potentially could have been avoided if they'd had better access to information. So I'm really, really pleased actually that drug and alcohol is now included in the health part of the new relationship, sex and health education, the new guidance that was published in 2020 and came into effect. And it's brilliant because the expectation is now that all young people are going to learn about different substances and the associated risks, and then hopefully they're going to be able to make much better, well-informed choices.
And traditionally, the sort of just don't do drugs mantra has been the main message taught at schools. Why do you think that this message has had to evolve?
Obviously, we all know that the safest way to use drugs is not to use them at all. But actually, what if it is already happening? And we know that in spite of the Just Say No message, a significant number of young people are using substances. The 2018 NHS Digital Smoking, Drinking and Drug Use Survey surveyed 11 to 15-year-olds, and 24% admitted to having used an illegal drug. And in the 2018 National Union of Students survey, which was surveying 16 to 24-year-olds, 40% admitted to having used an illegal substance in the last year and 11% in the last month. So we know that it is happening. It's not the majority, but it is a significant number of people. It's really, really important, obviously, that we're teaching about the law and the fact that a lot of the substances we're talking about are illegal or they have age restrictions around them. And there are consequences to breaking the law. But in just the same way as having sex before someone's 16, we still make sure that people have access to good information if they do choose to do those things. At It Happens Education, we always try and do pre-session questionnaires with our students. And the vast majority of students are asking us not to say, just don't do it. They're asking us to talk about if substance use is happening, how they can do it or help other people do it more safely. And there are some pretty high profile vocal advocates that are calling for education and harm reduction. A really good example of that is Chief Inspector Jason Q, who works for Thames Valley Violence Reduction Unit, and he's leading on drugs and exploitation and harm reduction. And he's really vocal in his support of drug testing available to members of the public, the work of the Loop. So it does feel like the perception is changing and the mantra is moving a lot more towards education, awareness and harm reduction.
Why do some people choose to use substances?
So substance use is nothing new. People have been using psychoactive substance for thousands of years, but there are all sorts of reasons and motivations for people using substances. So some people might be using out of curiosity or for pleasure. They might be using substances because that's what all their friends are doing, to escape reality or to relax, or maybe to change the way that they're thinking or feeling. They might be using substances to manage pain. That might be physical pain or indeed emotional pain. They might be using psychedelics to access other parts of their brain. They might be using study drugs to stay awake for longer or to perform better. There are so many different motivations. But from the outside looking in, we won't have any idea of what that motivation is. And that's particularly important when it comes to talking about addiction.
When people talk and think about drugs, they often think about addiction. Are the two always linked?
So that is a really good question, because not everyone that uses drugs will become addicted to them. And we know that because the number of people that report using drugs and the number of people that need to access drug or alcohol treatment is certainly not the same. We know that the vast majority of people that use drugs won't end up being addicted to them. That doesn't mean that a substance can't cause someone serious harm if they're using it recreationally, but it doesn't mean they're going to become addicted to it. But that is why it's so important that we're talking to everybody about drugs and the risks and how to reduce the level of harm if someone does choose to use them.
And this series is about the science of drugs. Why is it important that science underpins our discussion when we're talking about substances?
So it's essential that discussions about substances are evidence-based and are underpinned by the science. But I think that the illegality of a lot of the drugs that we need to talk about seems to get in the way of talking about them openly and honestly. So with legal substances, it's a lot easier to access the information that people need. Every bottle or can of alcohol has how many units is contained on it, and it will highlight the risks around drinking if someone's pregnant or they're breastfeeding. Cigarette packets contain lots of information about the possible risks of smoking, but with illegal substances, it's so much harder to get that information because there does still seem to be quite a lot of stigma and moral judgment around people that use illegal substances. But it is so important to share accurate, evidence-based, scientific information, because that's the only way that people are going to be able to make well-informed choices based on fact or understanding the specific risks that are going to be relevant to their particular set of circumstances. So if someone is on antidepressants or if they were on medication for ADHD, it's really important that they know how they might interact with some stimulant drugs, for example, and that information is not found on the piece of paper that comes inside their medication. So we really need to make sure that people are getting access to really good evidence-based scientific information to help them make choices that are going to be safer and right for them.
And so based on conversations that you've had with young people, what do you think are the most important things that young people know about when it comes to drugs?
So there's a few, but I think drug, set and setting covers quite a lot of them. So when I say drug, I mean that it's really, really important that a young person researches the specifics of that drug if they're considering using it, that they know all the risks related to that substance, that they know what a recommended dose would be, that they know what interactions it can have with other substances. It's really important that they also know that you can never really know what's in a drug, especially if it's illegal, unless, of course, it's been tested. And you never really know how you're going to react. And that's because of the idiosyncrasies of everyone's individual bodies. We all respond to things differently, but also about the way that some drugs are made. And so that means that if a group of people take MDMA from the same wrap, they can't assume that just because their friend seems fine, they're going to be fine too, because of the fact that some of those crystals in that wrap of MDMA might in fact be more potent than others. I think it's really important that people know that mixing drugs can be really dangerous. So that's what I would talk about in relation to drugs. In terms of set, when we're talking about set, we're talking about mindset. How is that person feeling in themselves? Are they choosing to use that substance for pleasure? Are they already having a really good time and taking that substance is going to enhance their experience? Or actually, are they feeling pretty sad? They might have just broken up with a partner. And in those instances, I'd suggest that it's most probably not going to be a very positive experience. And then setting is also really, really important. What environment is someone using that substance in? It's going to be a really different experience if someone's with their best friends in someone's house, they feel safe, compared to if somebody is at a festival, they're with people they don't really know that well, there's really loud music. So it's really, really important to be aware of the fact that someone's experience with the same drug can be very different depending on the setting. So if it's not a safe space and someone takes ketamine, for example, and they go into a K-hole, the risks are going to be different. If they get left on their own, they could be at risk of sexual assault or being robbed if they can't move. Those risks are going to be quite different if someone's at their friend's house, they're surrounded by people who they trust and they feel comfortable with. So it's really important to think about drug, set and setting. And probably the most important thing is to get help quickly if somebody thinks it's needed. And I've asked young people why they wait, why sometimes that feels like quite a difficult thing to do. And the answers are being scared of getting into trouble with their parents, scared of getting into trouble with the law, scared of knowing the right time to make that call, being afraid of looking a bit silly in front of their friends, But actually, I always say that in this country, you're not going to be arrested for calling paramedics. You could well save someone's life.